A spotlight has been placed on Australia's justice system with particular emphasis on juvenile detention and the continued increase in incarceration rates, especially among Indigenous Australians. In view of these issues, a growing number of voices are calling for strategies to curb imprisonment and reoffending and reframe the situation so that in the longer term, communities devastated by the crime cycle can be rebuilt.
Well, among them is suicide prevention researcher Jerry Georgatos, whose work in pursuing strategies to reduce suicide and self-harm incidents has meant working closely with those involved in the justice system, and he joins us now. Good morning to you. Jerry Georgatos, when we have spoken to you in the past in relation to suicide and self-harm, you've described that as being a crisis here in Australia. In view of what we're seeing now in terms of incarceration, particularly its impact on our Indigenous communities, how would you frame that situation?
The issues are multifactorial, intertwined. We do have a humanitarian crisis with suicides. 1 in 19 of all Aboriginal and Torres Strait Islander deaths is a suicide. In my research and the research of others similarly so, it's about 1 in 10. But as I said, the issues are multifactorial, intertwined. We hear about the proportionate population rates of Aboriginal and Torres Strait Islander people incarcerated. But let me invert that to you in accordance with my research and give you the crude totals so we understand the extensiveness of and what it actually means and the reach in terms of families. 1 in 9, no less than 1 in 9 of all Aboriginal and Torres Strait Islanders living on this continent nationally have been to prison. 1 in 9. From a racialised lens, that's amongst the highest in the world. The more west we travel across the country, the worse it gets. Northern Territory and Western Australia, it's 1 in 6. In Western Australia, 1 in 13 of all Aboriginal adult males is in prison today. So we've got all the elevated risk groups, a significant proportion of the elevated risk groups in that sad, tragic cohort that finishes up in prison. Now, the majority of them, in my view, and someone like me arguing from where I come from, and the experiences having worked pre-release and post-release with people, is of the lowest low levels of offending. 1 in 3 were homeless in the 12 months before incarceration. 1 in 4 had mental health issues before incarceration. We should be working with people in the situational trauma of incarceration, but we aren't. To speak a little bit more to the issues that we can delve from, 86% of the prison population nationally, and as I said, the more west we go, the worse it gets, hasn't completed year 12. 60%, 2 in 3, haven't completed year 10, and 40% haven't completed year 9.
Bring back in our studio guest, suicide prevention researcher Jerry Georgatos. And Jerry, you had a chance to hear what Mr Gunner had to say about Don Dale, about permanently funding Aboriginal groups. Are you optimistic about the future of incarceration rates in the Northern Territory?
I'd like to see incarceration rates go down, and there are ways forward, but they haven't been invested in. Listening to Chief Minister Gunner, well, I'll be meeting with him in September, as I'll be meeting with ministers, relevant ministers right across across the country, each jurisdiction alongside others, to discuss the suicide prevention space, present the Hope to Wellbeing to Work programs, the psychosocial support that needs be in juvenile detention and in our prisons. And that's the majorly way forward to reducing incarceration rates. I'll also be meeting with him to discuss the custody notification service. So far, it's only in New South Wales and the ACT. The custody notification service, when enabled, has actually saved lives. 15,000 detainees come before the custody notification service each year, and in New South Wales and the ACT, with the exception of the Miss Ma death, but the service wasn't actually enabled and wasn't contacted, and that recent tragic death has, aside the Miss Ma death, 0 deaths in police watch house custody since 1998 to today, and hopefully it may remain that way. And it's been championed in the last couple of years after the New South Wales government dropped the CNS because of funding, $500,000 per year. That's all it is, $526,000 per year. That's the cost of a coronial inquiry. This is about the saving of life and standing alongside others in their direst need when they're in custody. The Northern Territory needs it more than most. They've just had a recent death in custody at the Darwin Correctional Centre, but the first port of call should have been the CNS at the police watch house with the detainees. A Manningrida gentleman, I'm aware of the details, and he could have been assisted by a stout advocate of the custody notification service. If Chief Minister Gunner wants to demonstrate the authenticity and of his values and of his government's values He should implement immediately, he should move to table immediately the implementation of the Custody Notification Service in the Northern Territory, as similarly so should Western Australia. These two jurisdictions have a pronounced problem of Aboriginal and Torres Strait Islander people coming before the justice system. They're not often represented, and in terms of their health and welfare rights, they should be represented. Also, the police will benefit. The police unions, members of the police force, have actually asked me to advocate very toughly for the Custody Notification Service, because it also relieves the burden of health and welfare judgments upon themselves. We know of the tragedy of what happened to Miss Dew. She would more than likely probably be alive today if there had been a Custody Notification Service. One way forward is Chief Minister Gunner to table in the days or weeks ahead a motion to move for a Custody Notification Service in the Northern Territory, and we will see a saving of lives, as we have seen in New South Wales and the ACT. In terms of Don Dale, in terms of any juvenile detention facility, look, the Northern Territory actually has the highest incarceration rate of any region in the world. It jails 1 in 120 of its citizens. 1 in 120 of its citizens. To put that in context, the mother of all jailers is the United States. That's 1 in 131 that they jail. The Northern Territory is the mother of all jailers in terms of its rate, but the mother of Aboriginal and Torres Strait Islander incarceration is actually Western Australia. And Aboriginal and Torres Strait Islander males in Western Australia, 1 in 13 are in prison today. We've got to transform our prisons. I've worked with people pre and post release in the improving of life. They usually come out of the constancy of that trauma in prison, from that situational trauma of incarceration into composite and multiple trauma that they're exposed to in prison, much worse than what they came in. And we strand people post-release. All the research shows that you're 10 times more likely to die an unnatural death or suicide in the first year post-release. I do a lot of work with suicide trauma affected families, and we've had recent loss of individuals tragically who have just come out of prison in Western Australia, in the Northern Territory and elsewhere. They're lost in translation. They're 10 times the custodial predicament of deaths in custody, and any unnatural death in custody is a tragedy, but to have that also post-released at 10 times the rate, they're lost in translation.
So, Jerry, are there programs that you know of that are working but perhaps aren't being resourced effectively? And is government, in your opinion, doing enough to see those programs which would work and take a preventative stance rather than perhaps a more punishment-focused stance?
I've just given a narrative of statistics which goes to human translation, and government often argues that they're compelled by evidence-based methodologies, by evidence to lead all policy making, and I would say if only that were true. I've just given a statistical narrative that actually has culminated and arisen from a persistence in failed policies. They need to start investing not just in justice reinvestment, but in the prison to work to well-being, and the well-being and the healing is actually important, because if you're going to have retention in the navigation to education, training and jobs, you need that well-being and healing. Yes, there are programs that work, but they're not being invested in. I think the landscape's actually changing. There's an opportunity. We've got to try and keep it authentic. We've got to be careful of what we actually set up. We need to get in programs that actually support people from the point of entry to the point of exit. To give a quick example of what actually works, when I was in the tertiary sector, I brought I brought scores of people out of prison, former inmates, and off the streets into education, but I didn't just bridge them in. Most of them were First Nations people, Aboriginal and Torres Strait Islander people. I supported them psychosocially from the point of entry to the point of exit, and also with tuition from the point of entry to the point of exit. But in the end, the majority of them graduated, and none of them have reoffended or finished up homeless. Look, there's a program called the Nullamaya program, the Nullamaya Prison to Hope to Wellbeing to Work program. That's actually a recent program. It's got a couple of hundred people on its books, and it's already employed half of them because of training, mentoring and so forth. I'd love to talk to this someday, more opportune, but it's what we've got to invest in, and I urge our governments to invest in these programs.
Jerry Jordatis, suicide prevention researcher, thank you very much for taking the time to explore this issue with us this morning. Thank you.
Thank you, Miriam.
Thanks for coming in.
Andrew.